Warning: watch this video or you will regret it. The heart, the vital organ of the body, like many other organs, will gradually weaken over time. But there is a disease that does not cause severe pain, does not attack suddenly, but silently weakens the old heart day by day. That is congestive heart failure, the one that causes millions of elderly people in the world to die slowly in fatigue, shortness of breath, edema, and despair. Heart failure does not come immediately, but creeps in through every heavy breath, every restless sleep, every heavy edematous step. Even more frightening, many people think it is just a normal sign of old age. In today's video, we will uncover the truth about this disease, to understand, to prevent, and to protect the heart that has worked hard for us all its life. What is congestive heart failure? A disease not only for the elderly? Congestive heart failure is a condition in which the heart is no longer able to pump blood to nourish the body effectively. This is not a sudden disease, but a process of degeneration and damage that accumulates over time. As the heart weakens, the amount of blood delivered to the organs decreases, while blood stagnates in the lungs, liver, kidneys, and limbs. This causes a series of symptoms such as edema, shortness of breath, fatigue, persistent cough, and physical decline. Although heart failure can occur at any age, the elderly are the group with the highest risk. Aging heart muscle, hardened blood vessels, and accompanying diseases such as high blood pressure, diabetes, atherosclerosis, etc., make the heart work hard for many years. At some point, the heart is no longer able to support itself, and heart failure forms. The danger is that heart failure does not cause severe pain, so it is often overlooked. Older people only feel a little tired, have difficulty climbing stairs, sleep or wake up with difficulty breathing, and think that it is a normal sign of aging. This subjectivity causes the disease to develop silently for many months, many years. By the time the patient realizes the heart is seriously damaged, treatment becomes difficult and expensive. Therefore, understanding congestive heart failure early is the way to prevent a slow, prolonged, and painful death. Not only for the patient, but also for the whole family. Early signs that are easy to ignore. Congestive heart failure is not a disease that makes you collapse overnight. It begins with very faint, silent signs and is often ignored by the patient and family. The dangerous thing is that these symptoms are easily confused with old age, leading to subjectivity and not getting timely medical attention. The most common symptom is prolonged fatigue. Patients easily feel exhausted when doing housework, climbing stairs, or walking a short distance. However, many elderly people think this is normal at their age, so they do not go to the doctor. Next is difficulty breathing, especially when lying down or at night. Many people have to put their head on a high pillow to sleep, or wake up in the middle of the night because of a feeling of suffocation and dry cough. This is a sign that blood is stagnant in the lungs, a characteristic of left heart failure. Swollen feet and ankles are common manifestations of right heart failure. Edema is usually mild in the morning and gets worse in the afternoon. However, patients often think that old people tend to retain water, so they ignore this important sign. In addition, rapid heart rate, pounding heart, dizziness, lightheadedness, frequent urination at night are also warning signs. The body is now trying to compensate for the weak pumping of the heart with many different mechanisms. But the more it tries, the more exhausted the heart becomes. Early detection of heart failure is the only chance to prevent it. In the next section, we will delve into what causes the elderly to fall into a state of congestive heart failure and why it is likened to a slow, irreversible death. Why are the elderly susceptible to congestive heart failure? In the elderly, the heart has to endure decades of continuous work without rest. Along with natural aging, pathological factors, and wrong lifestyles accumulated over many years have silently pushed the heart to its final limit. One of the leading causes is chronic hypertension. When blood pressure is high for a long time, the heart must contract harder to pump blood throughout the body. Over time, the heart muscle thickens, stiffens, and weakens, called left ventricular hypertrophy. This condition prevents the heart from expanding to draw enough blood, leading to heart failure. Coronary atherosclerosis is also a common culprit. When the blood vessels that feed the heart are narrowed by cholesterol plaque, the amount of blood reaching the heart muscle decreases, causing a lack of oxygen. As a result, part of the heart muscle is damaged, reducing its ability to contract. If the patient has had a heart attack before, the risk of heart failure is even higher. In addition, type 2 diabetes, thyroid disease, obesity, and chronic anemia also contribute to the increased burden on the heart. These diseases are often associated with old age, but few people realize that they can be linked together to form a spiral that accelerates heart failure. In the next section, we will learn about measures to diagnose, monitor, and treat congestive heart failure, so that if we cannot fully recover, we can at least keep the heart beating longer and more steadily in the final years of life. Diagnosis and treatment. Delay means losing the chance to live. The most important thing with congestive heart failure is early diagnosis. Once the heart has failed, the chance of recovery is very low. But if detected early in the early stages, the patient can live a healthy life for many more years, significantly reducing the risk of death. To diagnose heart failure, the doctor will start with clinical symptoms such as shortness of breath, leg swelling, fatigue, night cough. Then there are paraclinical tests, including chest X-ray, to assess heart size and fluid in the lungs, electrocardiogram, ECG, to detect arrhythmias, echocardiogram. The most important method to measure the pumping function of the heart, BNP/NT, proBNP blood test, a biological marker specific to heart failure. Once the diagnosis is confirmed, the patient will be closely monitored and treated long-term. Currently, there are many types of drugs that support heart function, such as diuretics, reduce fluid retention, beta blockers, reduce heart rate, ACE inhibitors or ARNI, reduce heart burden, and many other groups of specific drugs. However, the use of drugs in the elderly must be extremely careful due to the possibility of side effects. Therefore, it is necessary to strictly follow the instructions. Do not arbitrarily stop or change the drug. In addition, patients need to change their lifestyle. Limit salt, bad fat, and drinking water if there is edema. Maintain a reasonable weight. Do light exercise such as walking, deep breathing. Keep your mind relaxed, avoid stress and anxiety. In some severe cases, it may be necessary to have a pacemaker or even a heart transplant. However, these methods only apply to people who are healthy and financially capable. Congestive heart failure is not a sudden pain. It is a silent wear and tear, a heart that has carried a lifetime of burden with each beat. The elderly do not fall because of an incident, but because every day their strength is drained by diseases that seem no big deal. Don't wait until you can't breathe to start worrying about your heart. Regular health checkups, blood pressure monitoring, treatment of underlying diseases, and maintaining a healthy lifestyle, that's the only way to protect your heart from a slow, painful death. If you find this video useful, please like, subscribe, and share to spread health knowledge to more people, especially loved ones who are entering their twilight years. Thank you for watching.